Hello, everyone. I know it's been a while, but with cases rising and the Delta variant spreading, I felt it was time for us to do an update. My name is Cindy Farr, and I'm still the incident commander for the COVID response at the Missoula City County Health Department, and today is August 5th, 2021. Today, I want to go over some of the case data that we're seeing, talk about the Delta variant, the new CDC guidance on mask use, and vaccines. So first, let's talk about the cases that we're seeing. In just 4 weeks, we've now more than tripled our daily average case per 100,000 people. Last month, that number hit a low of 3 cases per 100,000. Today, that number's jumped to 19 cases per 100,000 people. We've been seeing between 20 and 50 cases a day for the last couple of weeks, so we expect that that number is probably going to continue to rise, at least in the short term. Right now in Missoula County, there are 187 active cases of COVID-19. These are numbers that we haven't seen since back in March, and we've now had 102 deaths in Missoula County. The newest challenge for us here at the health department is that back in the spring, we were still seeing relatively small numbers of close contacts to positive cases, and now we're seeing upwards of 20 or more close contacts for each positive case. So that's definitely keeping us busy, and we're scaling back up with staffing to make sure that we have the capacity for that. We're also seeing a similar trend all across Montana and actually across the country right now. In Montana, we're seeing a significant rise in cases in most of the medium to large size counties. So next, let's talk a little bit about the Delta variant. The CDC categorizes the Delta variant as a variant of concern. That means that it poses a significant threat to those who are not yet vaccinated and those who may be immune compromised or have other medical conditions that could put them at high risk. It spreads more easily and is more likely to cause severe illness. Many people may have heard on national media that this variant spreads as easily as chickenpox. For those that are not familiar with that, another way to think about it is that for each person who becomes sick with the Delta variant, without any preventative measures in place, they would infect 5 to 9 additional people. The other difference between this variant and the other strains of COVID that we've been seeing is that hospitals across the nation are really seeing a lot more younger people in their COVID wards. The good news is that the current vaccines that are available are still very effective at preventing infection from this variant as well. Here in Missoula County, we've been keeping track of the breakthrough infections or infections that occur in fully vaccinated individuals, and it is still staying at around 5%. So what that means is that 5% of fully vaccinated people do still get infected. But that's just what we would have expected with this vaccine because the vaccine is around 95% effective. And so far, when we have seen breakthrough cases, the person tends to get much more mild symptoms. In addition to vaccination, other preventative measures that we've used for most of the last year and a half are also effective at preventing infection with the Delta variant. Social distancing, frequent hand washing, use of face masks, and keeping your social circles small are all still good practices while the spread of COVID-19 in Missoula County is high. Check yourself for COVID-19 symptoms and stay home if you're sick. We still offer the free COVID-19 testing at our Flynn Lane and mobile clinics, and the information for that is on missoulainfo.com, or you can call 258-INFO to get more information. So next, let's talk about masks. On Tuesday, July 27th, the CDC updated its mask guidance. Based on the latest science concerning the Delta variant, the CDC now recommends that both vaccinated and unvaccinated individuals in counties that are experiencing significant spread of the virus wear masks in situations where social distancing is not possible. Missoula County was identified by the CDC as a county that should follow that guidance. I know that this is really frustrating for people to hear, and we're not implementing a mask mandate, but it is a strong recommendation that people wear masks regardless of their vaccination status when in public settings. The reason for this change is that the virus has changed over time, as coronaviruses are known to do. So with the rapid spread of the Delta variant, we need to just re-implement some of those protective behaviors that we thought we had moved past. That said, there are still some settings where masks are mandated, such as public transportation and school buses, as well as many medical facilities. Okay, so now let's talk about vaccination data in Missoula County. Right now, 12 to 29-year-olds remain the group with the lowest vaccine uptake. This is bad news as we're moving into school and college classes getting ready to start next month. So we're highly encouraging everyone, particularly in this group, to get vaccinated as soon as possible. Even if individuals feel that they won't get severely sick if they contract COVID, that won't necessarily be the case with the Delta variant. It's also just as important to simply reduce transmission in the community. This helps to stop the virus from mutating any further into a variant that may be able to get around the vaccines completely. So some of the benefits to getting vaccinated, if you getting vaccinated will help kids avoid quarantine under most circumstances, meaning that they'll be able to stay in the classroom this fall. A high vaccination rate in kids will not only protect your child, but the other students as well by contributing to that herd immunity protection in those kind of congregate settings. This will also help kids that are too young to get vaccinated or kids with weaker immune systems, such as those with Down syndrome or childhood cancers or other immune compromises. It'll help keep them from getting sick as well. So lastly, there are some people that are wanting to know if they can get a booster or a third dose of the COVID vaccine. While other countries, such as Israel, have been offering a third Pfizer dose to immune compromised residents, the health department cannot give anyone a third dose. The health department has to follow CDC guidance, which does not include giving a third dose at this time. So just be aware of that. Okay, so that was a lot of information for today. I'll be resuming the weekly updates beginning 2 weeks from now, so you can stay informed as things change moving into the fall. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. You can follow us on Facebook at the Missoula City County Health Department Facebook page. You can check out our website at missoulainfo.com. There's lots of great information there, as well as all of the data for Missoula County. And you can come get a vaccine at our Southgate Mall clinic. You can make an appointment for that, or you can just come in as a walk-in whenever it's convenient for you, or you can catch us at any of our mobile or pop-up events that we've got going on out in the community. And you can call 258-INFO for more information or to schedule a COVID test. So until next time, everybody, stay healthy.